Hi, John.
Hello, Sylvie.
At the Beljanski Foundation, with the increased number of cancers that we see recently, we also receive an increased number of inquiries about possible alternatives to chemotherapy and radiotherapy. And we need to help those people and give them answers. Obviously, they are very afraid of chemotherapy and radiotherapy because the first thing you think of when you speak of pronounce those words are nausea, vomiting, burns. So obviously, I mean, it's legitimately they are looking for solutions. What would you say to those people who are looking for solutions?
Well, I would begin by saying that I sympathize with their search. If you go back and look at the history of chemotherapy, for example, it started out using mustard gas. And there was an idea that tumors might shrink under the influence of this toxic agent, but it's a toxic agent. And even though it showed effect against tumors, it also was toxic to the body. And ever since then, there have been other compounds, well known drugs, some not so well known, that do have some efficacy against the tumor, but have at times debilitating side effects. So the search for alternatives that are effective but less toxic, that induce fewer side effects, is just very widespread. And I think one of the things we have in the Beljanski world are plant extracts developed by a scientist who was alert, keenly aware of this issue of toxicity, and developed plant extracts that are devoid of side effects and toxicity that so many of us are used to from mainstream chemotherapies and radiotherapies. So these two are Pau Pereira and Revolfia vomitoria. Pau Pereira is extracted from the bark of a tree that grows in the Amazon rainforest, and Revolfia vomitoria is extracted from the root bark of a shrub that grows more widely, but in West Africa, for example. And these extracts have now been studied for quite some time, initially by Mirko Beljanski at the Pasteur Institute in Paris, France, and subsequently by under research sponsored by the Beljanski Foundation here in the United States, at Columbia University and Kansas University Medical Center, and at Nanjing University in China. So we have an international enterprise to extend the study of these plant extracts. And we now have documented results showing efficacy against a wide variety of cancers, including prostate and difficult cancers like ovarian and pancreatic. And we're moving forward with new studies. So there's a broad spectrum of activity, which is one of the other advantages, and there is selectivity of action. Both extracts kill cancer cells, but they have no interest in your healthy cells or tissues. They cause no harm.
Based on what do you say that there is selectivity of action? This is very important because if there is selectivity, it doesn't going to destroy healthy cells, and meaning will be no toxicity and no side effects. Can you tell us more about this selectivity of action?
Sure. Uh, the point is that a universal feature of cancers, virtually all cancers we know about, in all types of tissue and of both genders, suffer from DNA damage or DNA destabilization. This means that a combination of largely oxidative reactions and binding of carcinogens yields an altered structure in the cancer cell DNA. It's no longer healthy, it's no longer a tight duplex, it's actually damaged at the chemical level, and it's also, the hydrogen bonds may be broken and it's destabilized by separation of the strands. This forms the target for the active compounds in these two extracts. And if you're targeting that specifically, the damaged DNA, the target is only found in cancer cells. There is no target in a healthy cell. And so there's no reaction, there's no reactivity.
So it is because it has these recognized these specific targets that it's the plant extracts have been shown to work just as well on prostate cancer, on ovarian cancer, and pancreatic cancer, and actually many others that have not been specifically studied by the Beljanski Foundation, but I believe Mirko Beljanski showed himself the selectivity of action on the glioblastoma and astrocyte, which are brain cells, right?
That's right. He published one of his papers showed 16 different cancer cell lines of a variety of types. And we have continued that. And the evidence is now, I can call it overwhelming, the broad spectrum activity. And so I urge, if we began with a talk about the people searching for alternatives to chemotherapy and radiation therapy, and invite anyone interested to contact us. Look at beljanski.org, send us some emails, look at the site. It's very informative. You can see all the publications. So I've referred to several cancers, and these are well-documented, well-conducted experiments by experts in the industry. So we can make these statements with justification.
And one can ask his or her doctor to use the RGCC test actually to draw some blood and check if the tumor of this particular patient will actually respond to Pau-Pereira and Revolvia vomitoria, because RGCC testing was with one product which contains both extracts, right?
That's exactly right. And I think it's important that RGCC is available. And as you say, individuals who are interested in trying this approach can have their own cancer cells tested by the RGC laboratory to see if the products work against their own cancer. So it's personalized medicine. It's a new era, and we're part of it. And these plant extracts have already shown to work effectively again in individual patients' cancers of many different types.
Okay, that's hope for a lot of people, I believe. Thank you, John.
Thank you very much.